Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered why someone's eyes might be bulging out more than usual? The culprit could be Graves' disease, an autoimmune disorder that triggers hyperthyroidism. Autoimmune disorders are a fascinating yet perplexing phenomenon where the body, in a misguided bid to protect itself, ends up attacking its own cells. For Graves' disease, this internal skirmish leads to an overactive thyroid, causing a range of signs including those prominent eyes. Graves' disease, a disruption within our own body's defenses, can lead to a host of unexpected symptoms. But what causes the body to turn against its own thyroid gland in Graves' disease? Well, the exact trigger remains a mystery, but a combination of factors are usually at play. One significant player is our genes. Yes, Graves' disease often runs in families, suggesting a genetic predisposition. If a close relative has Graves', your chances of developing it increase. But genes are just part of the story. Environmental factors like stress or infection can also act as triggers, setting off a chain reaction in the body. Let's dive a little deeper. Graves' disease is an autoimmune condition where the immune system malfunctions. Instead of protecting the body, it produces abnormal antibodies that stimulate the thyroid gland to release excessive amounts of thyroid hormone. This overactivity results in the symptoms we associate with Graves' disease. While the exact cause remains elusive, a combination of genetic predisposition and environmental triggers often play a pivotal role. So, how would you know if you or someone else might have Graves' disease? This is a question we often get, and rightly so. Knowing the signs and symptoms can be the first step towards getting the right help. One of the most common symptoms is anxiety. It is not your regular run-of-the-mill anxiety. This is a heightened, persistent feeling of restlessness that doesn't seem to ease. Another telltale sign is tremors, particularly in your hands. Imagine trying to hold a cup of coffee, but your hands are shaking uncontrollably. This can be a significant red flag. Weight loss is another symptom that can point towards Graves' disease. This is not the weight loss that comes from a healthy diet or regular exercise. It's an unexplained, sudden weight loss that happens even when your appetite and food intake stay the same, or even increase. An enlarged thyroid, also known as a goiter, can be a clear indication of Graves' disease. It's like having a lump at the base of your neck that wasn't there before. Lastly, changes in the eyes are a common symptom. This can range from mild symptoms like redness or tearing, to more severe symptoms like bulging eyes or double vision. But remember, symptoms can vary greatly from person to person, and not everyone will experience all of these symptoms. Despite the range of symptoms, the sudden onset and their persistent nature often point towards Graves' disease. Graves' disease, an unexpected turn of events within our own body, can be a bewildering condition. It's a mystery that unfolds within the intricate labyrinths of our immune system, leading to an overactive thyroid, or hyperthyroidism. The thyroid, a small butterfly-shaped gland at the base of our neck, becomes a stage for a dramatic play put on by our own body, producing an excess of thyroid hormones that accelerate the body's metabolism. The exact causes of Graves' disease remain shrouded in medical mystery, but it's believed to be an interplay of genetic and environmental factors. Picture a domino effect, where one piece tips over, setting off a chain reaction. In the case of Graves' disease, genetic predisposition may be the first domino to fall, potentially triggered by environmental factors such as stress or infection. However, the full picture is yet to be unraveled. The symptoms of Graves' disease can be as varied as the colors of a rainbow, but they often share a common trait. They are sudden and persistent. Imagine waking up one day to find your heart racing, your skin unusually warm and moist, and your hands trembling slightly. You may feel unusually tired, even after a good night's sleep. Your eyes may seem larger, and you may experience unexplained weight loss. These are some of the telltale signs of Graves' disease, sudden guests at the party that is your body, refusing to leave. The diagnosis of Graves' disease involves a series of tests, including blood tests and imaging, to confirm the overactivity of the thyroid gland. Once diagnosed, treatment options can be explored, ranging from medication to control the overactive thyroid to more definitive treatments like surgery or radioactive iodine therapy. Understanding Graves' disease is the first step towards managing it, making it crucial to stay informed and vigilant about this unexpected intruder within our own bodies. UMCC, your ultimate medical consultant connectors.